Hello, and welcome to the finale of the RCNi Nurse Awards, the first awards held as a virtual event. I am really pleased to have the opportunity to welcome you to the awards and say a few words to you all. I am proud in my role as Chief Executive and General Secretary of the Royal College of Nursing to represent our members and the nursing profession more widely. And I have never been more so than this year. 2020 was one where nursing was always going to be in the spotlight as the World Health Organization International Year of the Nurse and Midwife. We had planned to join in a year of celebration with special focus on the contribution of nursing to outcomes globally. But we didn't expect it would be alongside a global pandemic. Working with COVID-19 these past months has not been easy. I know you have been under incredible pressure and strain during the pandemic, but your commitment and dedication to our profession makes me incredibly proud. Thank you for everything you continue to do for those you care for, their families and your colleagues. And well done to all the finalists and award winners. Your contribution to our profession is recognised and valued. So now, before we find out who will be named the RCN Nurse of the Year 2020, let's hear from some of our Nurse Awards winners and finalists about how they are meeting the challenge of COVID-19.
It's very difficult to talk about the positives when you think of COVID, when you think of what you've been through. I don't think any of us could have comprehended the level of stock we would need in a month. We would get emails from suppliers saying all stocks were being diverted to the NHS. It was almost like we were forgotten.
We were all just very frightened about what it meant and what it would mean for our working patterns and bringing it home and passing it on to loved ones, protecting ourselves. The challenges were looking at the best way to facilitate end-of-life care that was dignified and met the needs of the department as well as the needs of the patient.
We've had people come to us that believe that they have found the cure for COVID, that drinking bleach would cure COVID. We've had people present to us who were redeployed from one area of healthcare and kind of straight into an area that they were unfamiliar with, without preparation, without support, and they have been traumatised by what they've seen.
It changed everything about our way of working. It just completely turned it on its head.
We did lose staff across our footprint during COVID. So we created a flag to go over the condolence trolley. We've had all staff playing a guard of honour as the staff were being taken to the mortuary. So although it's been really, really tough, it's been, we need to show, we really, really do care.
What supported us are the families. They've sent videos, they've done fun things, they've sent care packages. It's helped us look at things in a different way, particularly with technology. We've done staff clinics, we do family clinics, and kindness has really been evident across all of our care homes. Kindness from staff, commitment from staff, but kindness from the community and families as well.
Our patient feedback that we got was amazing. The patients loved being cared for by us. People came all together and it created such a lovely atmosphere. There was like a sense of unity for that we wanted to fight the pandemic.
When a hotel place came up for somebody, we were able to visit them on the street. We could symptom screen them, stabilise their drug use as well in lots of cases. Yeah, we saw real improvements in health, which were amazing.
We take handprints and lip kisses and photographs of tattoos. That's what we do. Free compassionate work beyond anybody's expectation.
The commitment and dedication of nurses during the pandemic has been applauded by the public, but the finalists of the Patient's Choice category of the RCNi Nurse Awards demonstrate the diversity of modern nursing and its impact on the lives of people of all ages, from all walks of life and in a wide range of settings. The award, sponsored by the Nursing Standard, enables patients and families to nominate a member of the nursing team who has provided exceptional care. The winner has been decided by a public vote. Let's meet our finalists.
Our first finalist is Isobel Corrie. Here, nominator James Birch describes how she saved his life.
Just over a year ago, I was flying home from a holiday with my partner. I had a cardiac arrest and my heart stopped. Isobel was on that flight. She wasn't working. She'd only just qualified. She hadn't started working as a nurse yet, but when the call came for help, she stepped forward and she very bravely spent 45 minutes bringing me back from the dead. And the reason I'm here talking to you today is because of the work she did. That night, she didn't just change my life, she changed the life of my children, my partner, and all my friends and family. And we'd all like to say thank you, Isobel.
Next, we have Marie Perry. Nicola Prothero-Jones described why she nominated her on behalf of a man with learning disabilities.
I nominated Marie because of her dedication to case management. If it wasn't for Marie, I don't think the gentleman would be alive today. The gentleman that the award's about would really want to thank Marie for saving his life, for changing his whole views on the world now. You know, he'd wanted to know that he's grateful and he's smiling and he's happy again. The specifics of the case, you know, Marie worked tirelessly, you know, pulling together one of the largest multidisciplinary teams I've worked in for a long time, with police, social services, every profession allied to medicine going, you know, and she orchestrated the whole lot, you know, as the conductor.
Our third finalist is HIV nurse specialist Mary Makarau. Here, she explains how she supports the 3 people who nominated her.
I believe my patients nominated me for this wonderful award, Patient Choice Award, in appreciation for what I have done for them, the care and support that I've provided for them in the community. I meet with them in person and do a holistic assessment of their needs. Quite often I find that it's not just the HIV that is the problem for them. They have got other issues, and sometimes quite major issues that are having to deal with. For example, they may have immigration issues, or they may have dietetic issues or housing issues. So depending on what I find out as I do the assessment, most of the time I have to, with their consent, I have to liaise with other professionals and ask them to assist me in meeting their needs.
Now let's find out from Olivia McManus why she nominated our 4th finalist, Noreen Ferguson.
Hello. For many years, our health visitor Noreen has had such a tremendous impact on so many families here, I felt compelled to nominate her. She always goes the extra mile, supporting us on our journey as parents, empowering us with skills and confidence, thus ultimately benefiting our children. It was this outstanding support that was crucial to our family as she guided us through our son's autism diagnosis. Noreen brought us to a place where we now take it in our stride, and Dara is thriving. For this, I'm indebted to Noreen. So Noreen, from our family, from the hundreds of other families, thank you, congratulations on being a finalist, and good luck.
Thank you, Noreen.
Our next finalist is mental health nurse Rebecca Betts-Richards. Let's hear from her nominators why they think she should win.
My name's Hayley and I'm a client at Chegworth House, and I've been here for the past 4 years now. Rebecca is kind, caring and has a heart of gold.
My name's Lauren, I'm one of the clients here at Chegworth House. Rebecca is more than deserving of this award. She treats us with respect and she makes us feel validated. She never panics, she's always calm in situations. She's helped me in so many ways and I'll forever be grateful for her. I've known her for 2 years and she's been one of the professionals that have helped me the most that I've met along my journey. She's helping me put my jigsaw back together again.
Trevor Quinlan nominated our next finalist, Rekha Govindan. Here, she describes how she saved his life.
When he admitted to Chegworth, he had a large abdominal wound of 15 centimeters plus other health conditions, contributing a prognosis of 2 to 3 weeks by his consultant. anyone who admitted to Chegworth, we always approach a person-centered care, and for Trevor it was wound care, poor nutrition, poor mobility and lack of fighting spirit. As a team, we work towards to achieve these goals of his problems, and we achieved. At the end, he managed to live independently at the seaside. I am honoured and delighted about this nomination. I'm proud as a care home manager as we can save the lives in the community when it was being written off.
The votes have been counted. The public has made its decision. And the winner is Isobel Corrie.
Congratulations, what an incredible story. The category finalists in the 2020 awards showcase the best of nursing. Here's RCN Deputy President Yvonne Cogill, Chair of the judging panel on the standard of entries this year.
This year, as head judge of the RCNi Awards, I have been able to see the most fantastic presentations. All of the nurses that put in their projects were brilliant. It was such a hard job to choose who the winners were, and in fact, all of them are winners in my view. The work that they're doing, the innovations, the projects, all add up to making sure that our NHS is the best service in the world, as well as our social care, care homes, independent sector, across the board in terms of healthcare. The quality of the work people are doing out there just blew me away. And it says to me that all of our nurses, wherever they work, regardless of grade and background, are pretty special people. They're all winners in my eyes.
Thanks, Yvonne. Before we turn to our most prestigious award, RCN Nurse of the Year, let's hear from RCN Ambassador, actor Emilia Clarke.
Thank you, Donna, and hello everyone. What an absolute pleasure to join you to celebrate this very special occasion of the 2020 RCNi Nurse Awards. I was first appointed as Ambassador for the Royal College of Nursing back in 2018, making this my third award ceremony. I'm sorry not to be with you in person, but what an honour it is to join you for these virtual celebrations, especially in such a momentous year. Standing with you as an ambassador for the incredible work you do day in and day out is a great privilege. Without the care, kindness and compassion of people like you, I simply would not be here today. I'm very proud of my work supporting the Royal College of Nursing and the opportunity this brings to help elevate a profession that means so much to me. You demonstrate tireless dedication, innovation, compassion and skill, and I am humbled to mark Florence Nightingale's bicentennial with you in this, the International Year of the Nurse and the Midwife. I'm excited to share that this year, the RCNi Nurse Awards have attracted 700 entries from outstanding nurses right across the UK. From Cornwall, Norfolk and Glamorgan to Lanarkshire, the Outer Hebrides and County Antrim. The range of skills demonstrated by these dedicated nurses is quite remarkable and speaks to the breadth and depth of work delivered by this outstanding profession. From caring for the tiniest premature babies and managing complex medical calculations, to precision planning end-of-life care and supporting loved ones who are left behind. I am also acutely aware of the extraordinary pressures the coronavirus pandemic has placed on nurses across the UK and around the world. At the height of the pandemic, scores of third-year students left their studies early to work in Nightingale hospitals. Thousands who had left the profession came back when they were needed. And all of you balanced risks to your friends and families with your own personal health and well-being at a time of immense strain. In spite of the pressures of COVID, I'm pleased to report that it has helped to reinforce the value of nursing in our society attracting the highest intake of student nurses in recent years. I have no doubt that nursing will continue to step up when we need it to, for centuries to come. For this, I thank and applaud each and every one of you. I wish you all a wonderful evening and every success in your career and journey as a nurse.
Thank you, Amelia. Now we come to the finale of Celebration of Nursing Excellence, the announcement of the RCN Nurse of the Year 2020, who will be revealed by RCN President Anne-Marie Rafferty. The Nurse of the Year is chosen from the winners of all our categories, so let's meet them.
Rosa Ungpakorn won the RCN-sponsored Advanced Nursing Practice Award for her street outreach service for rough sleepers. The winner of the Child Health category is Giselle Padmore Payne for her transition service for young adults with hereditary blood disorders. Kerry Lyons' Admiral Nurse Service won the NHS England-sponsored Commitment to Carers category for her service supporting families experiencing dementia. The Excellence in Cancer Research Nursing category, sponsored by Cancer Research UK, has been won by Ben Hood for his work to secure future recruitment to research roles. The NHS England-sponsored General Practice and Community Nursing Award has been won by Marie Roberts for her drive to improve oral care in care homes. The Innovations in Your Specialty Award, sponsored by Impulses, was won by Anna Waddington for her work with young people at risk of serious violence. Our Learning Disability Nursing Award winner is the Healthcare Park Prison Team for its dedicated wing for people with a learning disability or autism. Jeff Brennan has won the Mental Health Nursing category for his work reducing restrictive practices worldwide. Our Student Nurse of the Year in this NMC-sponsored category is Temitope Babajide for her community and hospital projects in Ghana. Our Nursing Support Worker Award, sponsored by the RCN, was won by Ria Pugh-Davis for work ensuring people with a learning disability can have the surgery they need. And finally, our Team of the Year award, sponsored by LV, went to the Care Home Assessment Team. It supports care homes to provide excellent care to their residents. To reveal the winner, here's RCN's President, Anne-Marie Rafferty.
Tonight is a celebration of nursing brilliance, and everyone who's been shortlisted should be rightly proud as they are a winner. Together, the collective talent showcases some of the best that nursing can offer. In this, the International Year of the Nurse and the Midwife, and the COVID crisis, it's even more impressive that the winner has excelled in circumstances of such profound pressure. And it's this improvisatory and innovative impulse which has persuaded the judges to select our supreme winner this evening. And I'm thrilled to announce the overarching Nurse of the Year in this Year of the Nurse, Anna Waddington. Congratulations to Anna. And let's see why Anna has been crowned RCN Nurse of the Year.
Violence has become totally normalised within young people now. It is normal to be stabbed, and that's why I want healthcare professionals to talk to young people and have an opportunity to learn from them, because it feels like we've completely disconnected. Your stance is an opportunity for young people to learn a skill, but it's also an opportunity for healthcare professionals to connect with young people through our workshops by teaching a skill and learning about the young person's experience to be able to inform them on how best to treat them when seeing them in practice, but also to reinvigorate the compassion for these young people.
I wanted to nominate Anna because she has spent so much time, so much of her own time. She spent a lot of her own money. She was so passionate about this project, and that's why, you know, after 2 years, she's got 150 volunteers.
Anna's vision has kept me with your stance for this long whilst I'm working full time, and I've kind of got more involved rather than less involved.
Someone like Anna, who is as strong an advocate as she is,
reminds doctors and nurses why they're there, what they're doing that job for, who they're really looking out for, and the wider value of the work they're doing.
It's such a positive experience, and it opens your eyes and your experience and understanding of the community, and that informs how we manage our next patients who come into our emergency department.
Your Stance was founded and set up by myself in 2018. It came really from a sense of helplessness in my inability to support young people who had been affected by serious youth violence. Working in a major trauma centre, we received a 17-year-old young male who came to A&E, and he had been stabbed in the leg. Unfortunately, that young person did die, and they died in theatre. We don't know, but there is a chance that had his friends known what to do and put pressure on the wound, perhaps he would still be alive. And so that idea of being able to provide this basic knowledge to young people and empowering them with that knowledge so that they can be leaders in their own community really inspired me.
Honour is going out, literally going to young people, teaching them, talking to them, getting to know them, trying to understand them, and then equipping them with the skills that they need to save somebody's life.
Just didn't feel like my 10 minutes that I had with these patients was sufficient. I didn't know what else I could really do to help. And on top of that, I was noticing a real breakdown in compassion for these young people, seeing them as just a number as opposed to patients that were, in a really difficult situation, especially socially and economically.
We care. We want to know about their backgrounds. We want to help them. We're not just people in uniforms that are judging them. If she was Nurse of the Year, I think she'll probably keel over.
I mean, of course, if I was Nurse of the Year, that would be incredible. Definitely would be absolutely amazing.
Congratulations, Anna. You are the RCN Nurse of the Year in the International Year of the Nurse and Midwife. The impact you have made on young people at risk of violence and in building better understanding between young people and healthcare professionals is outstanding. And that brings the RCNi Nurse Awards 2020 to a close. But you can find out more about all of our amazing finalists at rcni.com/nurse-awards. Thank you for being a part of this celebration. Before you leave, please take a moment to remember the members of the nursing team who have died during the pandemic. Goodbye.